Hello, everyone, and welcome to our Gentu Product to Practice webinar. And thank you all for taking the time out of your busy days to be here with us today. I'd like to begin the session by acknowledging the traditional custodians of the land on which we meet virtually today. And for me, I'm based in Brisbane, so that's the Turrbal people and the Yuggera people. And I'd also like to pay my respects to elders past, present, and emerging. My name is Niamh Tobin, and I am the GM of Product for Practice Management and Oncology. Today, we're going to have a number of people sharing updates with us. This includes Bridget, one of the product managers for Gentu, Chris, who you guys have heard from previously, who is the product manager for the Gentu marketplace, and Tam Mackenzie, who is our principal designer here at Magentus. Now, today, our main focus is providing everyone with a product roadmap update. And so we'll give you an overview of what has been released recently in Gentu, and then we'll share quite a bit of detail about what you can expect to see become available in Gentu over the next few months. At the end, Tam is going to do a spotlight on our Gentu mobile app. For those of you who may not use the mobile app, it is designed to be a practitioner app and allows users to access patient information, appointments, and gives them the ability to do clinical documentation on the go. So Tam will talk us through some recent enhancements over the last 6 or 9 months in the mobile app, and also what the next focus there will be for the mobile app over the coming 6 months or so. At the very end, we will have time for Q&A. So please, you'll see in the webinar that there is a Q&A box. So if any questions pop up as we go through the webinar, please jump into that Q&A box and send us your question. We'll actually do our best to answer the questions as we go, so we will respond. And then at the end, we'll pull out any of themes of questions that might be there, and we'll answer a couple live as well. A question that we often get is, will the recording of the webinar be shared afterwards? It absolutely will. So the session is being recorded. It'll be added to our YouTube channel over the next week or so. And then it'll also be sent out to all Gentu customers via email as well. Now, before we get into the product roadmap updates themselves, I do just want to spend a minute sharing a bit about our vision, as this is how we see ourselves helping you deliver better healthcare outcomes over the coming years. Our vision has been centered around a technology platform, which we're using to provide you with ongoing product innovations into the future. Some of these we have been developing ourselves and will continue to develop ourselves. And some of these will be provided by integrations with third-party products that perhaps you use in your practice or would like to use in your practice alongside Gentu. But really, we are working towards 3 objectives to better support practices. One is to create a more empowered patient experience. So helping you to automate the patient journey, create a more modern experience for patients, but also enable you to gain some admin efficiency in how you support patients through their journey. Lots has been happening in the last 12 months in this space, particularly in around our marketplace, where we've added online appointment booking tools and patient registration tools. And Chris is going to talk about those and showcase them in a bit more detail shortly. Our second goal is focused on connecting up what is a very disconnected healthcare ecosystem today. So we're conscious that you have to interact with private hospitals, labs, pharmacies, aged care facilities. And it's often not easy to have all of the information that you need at the point of care with the patient. And so we have been working to try and connect up some of these parts of the ecosystem, specifically around private hospitals and pathology and radiology labs, and provide mechanisms not only for sharing data, but to support real-time collaboration between yourselves and these other parts of the ecosystem. So we'll talk a bit more today about e-requests and e-bookings as well. And then the third area is to bring data-driven insights into your workflow. So this is really about clinical decision support, workflow assistance or workflow automation, and any insights that we can surface up that might help you improve your practice's performance. So over the last 12 or 18 months, the team has been using AI tools to structure unstructured data that exists within letters and consult notes and things like that. And we're just at the point now where we're starting to present these insights back to practices in the form of dashboards. So I'll give a bit of an update on that later. Now, alongside these goals and objectives, though, we are also committed to improving the core experience across Gentu and our mobile app, and just understanding how we can, I guess, help practices to better book and manage appointments, consult with patients, and get paid for the services, I guess, that you've provided to that you have already provided to the patients. So I'm going to hand over to Bridget, who will actually talk in a bit more detail about those experiences initially, and what we have been doing recently to improve admin and clinical workflows across Gentu. Over to you, Bea.
Thank you. Let me just grab control of the screen. Jamie, I might need to get you to click for me because I can't get control. That's all right. All right, thank you, Nee. Thank you for the introduction, and I'm pretty excited to be here today for the first time for my webinar appearance. And I have the honor of being able to talk through a lot of the exciting customer problems that we've been solving recently in Gentu. So if we could jump to the next slide. Thanks, Jamie. We'll kick off with some of the changes we've been making within the prescribing workflow. So a really large piece of feedback that we heard via our Voice of Customer program, and especially from our customers who have migrated to us from our Genie desktop solution, was that they were under the ability to have prescribing favorites, if you like. So those handful of drugs that you may be regularly prescribing, maybe like if you're a surgeon, those painkillers that you give post-op, those kind of things, without having to actually go through and do the details of prescribing them every single time. So we've now implemented our quick scripts, which allows you to easily and quickly prescribe those medications without having to type through all those things like the dose, frequency, instructions each time, hopefully saving that time for you, and then also just reducing the frustration of having to do repetitive tasks that you've had to do up until now. So it's been really well received. We've had great volumes of numbers, and we've seen a lot of customers really making the most of this new feature. So that's been really, really exciting to get that out there for everyone. Now, whilst we were in the prescribing area, we also incorporated the MIMS production information document. So you can now view the scientific information relevant to the selected medicine. So we already have the consumer medicines information, but we now have the MIMS product information available as well. So that's been a good addition. All right, if we could jump through, thanks, Jamie. Now, another piece of functionality we've delivered is the ability to email letters to practitioners, both with and without a password. So we've previously had the ability to be able to send emails to patients. I'm sure no doubt you're very familiar with the email functionality to send correspondence, but we've now extended that functionality to practitioners as well. We had our initial release of this functionality, and we were very quick to hear the feedback from all of you that you wanted the ability to also have the option to send without a password. So we're very happy that in the last fortnight or so, we've been able to actually accommodate that change, and you now have the ability to also send emails to practitioners without the password on there. Now, obviously, we always do encourage you to make sure you're taking care with dealing with PHI information and things, but the level of restriction and the processes that you want to put in place around emailing is now able to be controlled at a practice level. Whilst we were incorporating this work, we also spent some time to simplify the password format for correspondence. So now when patients receive a quote or an invoice emailed to them, hopefully there's no longer that confusion about the password. I know myself personally as someone who's attended a Gentu clinic, the amount of times I incorrectly typed my password wrong when I received correspondence was much higher than I care to admit. So I was very happy, as I'm sure a lot of you are, without having to take those calls from patients who just don't quite get that password right. All right, the next thing we've been working on has been doing some work in our clinical window of Gentu to really try and maximize the reading areas in here and reduce scrolling. We've heard a lot of feedback around there's so much scrolling, there's so much clicking, and that's been a really big focus for us and will continue to be a big focus for us in Gentu in the next little while. And Neve will talk a bit more about that a little bit later on. You may have noticed already that we've done some updates within this clinical window. We've reduced the padding. So some of these things may seem cosmetic changes, but we're really trying to start thinking about that future plan and how we can kind of work towards this vision of less clutter, more things on one screen, less scrolling. So we've increased the header and put things up there. We've reduced the padding to get more things on one screen and hopefully less scrolling around. Another common piece of feedback that we had via our VOC, and a lot of these changes that you'll see that we're talking about today have been really driven by our Voice of Customer program and feedback from customers. So thank you for everyone who does contribute to that. Was the ability to want to try and include past history information on letters. So we've now also added some new letter references for ceased diagnoses, or your inactive diagnosis, if you like, which includes the notes as well. So you can now include that reference in your letters. So anywhere that you want to have a past history, you can now include that letter reference and have your letters pre-populate with that information. Like I mentioned, you'll hear Neve talk a little bit more about some of the other clinical changes coming up in the what's coming next, but do watch this space in the clinical. There's some exciting changes coming in that area. Okay, next up, we tackled some of the problems you've been experiencing with managing referrals at a practice. And the first one I really love seeing, and that's the ability to search by a provider number. So I had this feedback from a number of customers, Voices customers were the same, but I was also lucky enough to go out to some practices to actually see some of these pain points firsthand with practices who had multiple referring doctors who worked at multiple locations. So may have had 8, 10 kind of address book entries, and trying to get the right one the first time when adding a referral was a real pain point. So we've removed that kind of pain point by allowing you to search by the provider number. Now you can just grab it straight from the referral that's been emailed through to you or sent straight through your system and use that to search by the provider number in the address book. So nice and easy, thankfully, and it's been hopefully a win for you guys in terms of being able to do some of those things a little bit faster, which is what we're all about. We've also added some functionality to add a referred to field on referrals. So now you can specify who a referral is to within the practice. And this is really hoping to address some of the pain points for some of our multi-practitioner practices who have referrals coming into multiple doctors for multiple problems. For some patients, they might be coming into a practice and then they're seeing one doctor for one specialty and something for something else. So we can now specify who that referral is for. We've also extended that logic in both the invoicing and in the appointment book. So now when you're checking the referrals in the appointment book, Gentu will actually check and make sure that the referral is for the doctor that they're seeing and alert you if the referral isn't valid for the particular provider that they're viewing. And same in the invoice screen. Now when you invoice, the Gentu will do the checking for you. The logic is basically based on the servicing provider. So once you choose your servicing provider, Gentu now has the smarts to actually go and update that referral to be the one relevant to that provider. So hopefully, again, we're just trying to reduce some of that kind of cognitive load of having to work out which referral am I selecting, who am I changing it for, going back and forth between windows. We've tried to simplify that logic and make that a little bit simpler for you to be able to get the right referral the first time, and hopefully have less patients presenting without a referral or getting frustrated when they don't get their rebates. So big changes in the referrals, and thank you to everyone who did fill out our recent survey for feedback on that. It was great to see all of the feedback, and there's already been a few points in there, some changes and things, and some further improvements we can make on this functionality. So do take the time to please fill out that feedback when we get it, because already there's been a few points that I've managed to speak to a few customers in the last few days about some extra tweaks we can make. So it's always great to hear that, yes, you're liking our changes, but there's always room for improvement. So thank you for people for providing that feedback. Okay, over in the appointment book, we've made some efficiency improvements to making both the appointment book and the appointment list look a bit easier and make it a bit easier for you to work. So in the appointment list view, and you can see that at the top of the screen there, we've included the day of the week at the start. Might seem like a simple thing, but sometimes it's a lot easier to be like, oh yeah, I saw you were in here last Monday, instead of having to try and work out when was the second and what was that. We've also updated the type column. So previously the appointment type column that you can see there only ever said the appointment or procedure. So we've now pulled the appointment type through into that window, so you can actually see why the patient was in and what the color of the appointment was. And that means just at a quick visual glance, you can kind of get a bit of a history of those patients' appointments and what they've been for, without having to go back to the appointment book, find the appointment, check it, come back and forth and back and forth. Again, trying and get the information that you need in one spot. Whilst we were here, we also updated the appointment list printouts. So you'll now see there's a new feature to actually print the future appointments. And this is really, I guess, hopefully designed to help some of those practices who have patients who have booked in a series of future appointments. Things like, if you've got your midwives with all their antenatal visits and things coming up, you can now print just those future appointments, and they will print in the order of the next appointment followed. So we kind of reverse the order a little bit. So just trying to reduce some of those questions from customers and patients. When you had the previous list that had all of the historical appointments and past and present future, we've now got that extra option there. Another big thing that was well requested and we were able to finally implement was for coloured procedure types to be added for procedure appointments in the appointment book. So previously we had just pink appointments for procedures in the diary, and we had feedback from customers that it wasn't as easy to visualize what the day ahead looked like. So we've incorporated the same appointment type menu that you have for normal appointments, and that's now available for procedures. So you can now kind of color code your appointment book to your heart's content. I've seen some pretty beautiful and colorful appointment diaries out there, but it just means that at a glance you can see, okay, I've got 5 oranges, so I know I've got 5 colonoscopies. I've got room to fit in 2 endoscopies between the cleaning of the machines and all those kind of things. So hopefully making it a little bit easier to visualize things, and less again of that kind of cognitive load to have to try and read all the information, process what else can I fit in, those kind of things. Another piece that we did as well whilst we're in the appointment book, and this one's probably one of my favorite ones, is around the flagged appointment modal. So we had a lot of feedback about customers wanting to be able to see appointment alerts, and to be able to see that in the screen. We have now taken the flagged admin note that you can put in as an admin note, and when you're booking or creating an appointment, we will now reference that admin note and show it. So you can use it for things like, patient always runs late, so make sure you allow time, or they always take longer, so double book their appointments and things. So previously you had to kind of book the appointment, go through, click into the details, go into the admin notes, see if there was anything relevant, call the patient back because you've already booked the appointment. So hopefully now all the information that you need is front and center, and you can see it on the screen where you need it. And as you hover over that menu, you get the extra details about those appointment admin notes in the appointment book. So that's another really popular feature, and one that a lot of customers had requested. So it was great to be able to kind of close the loop for those customers and see that functionality go through. The last thing on this screen you'll see is we've also added an additional label. So the patient current provider label has now been added. This allows us to include the current patient details, but also with the current provider. So that can then be affixed to things like hospital charts for patients who are getting them into hospital. And that way everyone can actually know who that patient's being treated by. So they've got that current provider on there. Thanks, Jamie. If we go jump to the last one, the last focus area I'm going to talk on, and this one doesn't seem as much, I guess, a wow factor or as many front end things to kind of show people, but I think it's really important to spend a bit of time just speaking about some of the work that's been happening behind the scenes with our team. So this is a bit of, like I said, it's unseen changes a lot of the time, but it's in relation to Gentu's performance and responsiveness. And we've had data showing that the response times on some of our pages just weren't as fast as we'd really like them to be. And that lined up with customer feedback. And that was reiterating that some of these windows were just taking too long to load. So as a result, we spent a lot of time actually diving into our code and looking at what some of those queries are and how we might be able to refactor and rewrite some of that information. So on the screen, you can see here some of those kind of areas that we've focused on. So creating and viewing procedures, on online patient verification, SMS, organizational remittance, and we've just in the last kind of fortnight also done unresolved invoices. And there's been some massive improvements in those speeds in those areas. So hopefully you're seeing the same thing. Some of those windows were getting quite slow, especially for our larger practices who had a lot of data in there. So it's good that we've managed to spend some time and really knuckle down on increasing that performance. We're not just focusing on features and new things. We're making sure that the experience you have with the day-to-day Gentu is hopefully where you want it to be. We want Genie and Gentu, to be as fast and as efficient as possible. So you as a practice can be as fast and efficient as possible as well. So nice to see some of those improvements coming through. Phew. All right, that is a lot. And I think it just really reflects a lot of the work that the team have been very busily working away on since our last webinar, and really trying to focus on improving that Gentu experience for all of you. I'm now going to hand over to Chris, and he's going to provide a bit of an update on the Gentu marketplace. So over to you. Thanks, Chris.
Thanks for that, Bridget. Lots of really exciting updates there, which is great to see. So my name's Chris. I'm the product manager for the Gentu marketplace. We've had a lot of, we've had some really great progress in the marketplace in the 9 months since we launched back in October. And I'll talk you through first the recent updates and improvements, and then we'll look at what's coming soon as well before we go to broader coming soon for Gentu. So first of all, for those of you who've been following along, we launched initially with transcription use cases. We had quite a few diverse partners in there, some really interesting transcription tools in that space. Most recently, in terms of updates, VoiceBox has had a major relaunch recently. It now has an AI scribe capability as well. So it offers its new ambient AI transcription alongside still offering its traditional transcription offering, which can be good when you've got a team that wants to use a mix of those things. There's volume-based pricing and a couple of other things that make that offering interesting if you've not had a look at that one. And then the other, another one, very popular AI scribe. We now have Heidi Health integrated with Gentu. It is still in beta at the moment, so with a handful of practices. But we'll be looking ahead to launching to all practices, making that generally available, hopefully in the coming weeks. So keep an eye on the marketplace or the Gentu newsletter for that launch if you're a Heidi user. And then earlier in the year, we launched with Health Engine, and they've had a steady stream of updates since launching to continue to improve the broader online patient booking experience. So one of those is that the online patient registration, when patients sign up, will now directly update the patient demographic fields, just connecting that end to end and saving more admin effort and more completely automating that process. You can also use online registration forms for all patients via Health Engine, including those that don't book via Health Engine. So again, just sort of further improving that patient registration experience if you're using them. But most recently, they've now automated enabling patients to cancel or reschedule appointments online, directly from their booking or confirmation or reminder message. So previously, patients would need to call in. So if you're interested to switch on the automatic cancellation and rescheduling feature, check in with Health Engine, and I imagine we'll have a continued stream of improvements coming from them as well as we seek to improve that integration, continue to improve it. Consentic launched earlier in the year, so across online patient registration as well as digital consent workflows. They can now also directly update those patient demographic fields for patient registrations. So when patients fill out their form, the name, contact details, cards, emergency contacts, all of those details will be automatically updated directly into Gentu. And just waiting for the next slide to come up there. So Consult Med launched a couple months ago as well. So in a new category, we are looking to kind of broaden our range of use cases and problems that we solve in the marketplace. Consult Med currently will allow you to send outbound referrals and sync data from Gentu to make that easy. But in an upcoming feature, they'll also be looking at inbound referrals. Today, we'll take a closer look at those Consentic and Consult Med workflows. And I'll start with Consentic, and I want to take a closer look at the patient registration workflow. So there's more to look at in terms of the consent workflows, but we know that this is something that a lot of customers have wanted for a long time, automating that process. And so what I'll do is we'll have a look at that workflow. And so essentially this is inside Consentic. Within here, you can build custom registration forms to suit your practice. So within this form library, I can follow that wizard to create the form. Here you can select which individual fields you want to capture from the patient on the form. You can select the individual fields and build the form and choose essentially all of those elements you want to collect or anything that you want to leave out. And then just waiting for the video to catch up. Sorry, you also have a section for file attachments. So referrals or clinical photos, you can capture those. You also have a set of questions for collecting additional custom patient questions that you can add to the form. So things like medical history or other consents. All right, bear with me for a second. Here we go. So once the form is set up, you can send it to any number of patients at any time. Consentic has an integrated appointment book, which is a direct sync of your appointment book in Gentu with some additional features. So I can select multiple appointments by clicking the checkbox or send individually. And once the patient is selected, you can select the form to send. This can be then emailed to the patient, SMS to their phone, or they can also complete it now if they're in the practice. Now, if I switch to the patient view to show what it looks like for the patient to complete the form, having received the email, I'll open the form. I start filling out my name, my address, my Medicare and Health Fund details, emergency contacts. I can attach my referral letter. Basically, everything that I configured earlier in the form, we can collect, upload the referral, any of those custom questions. Sorry. So, for example, an advanced care directive or additional consent questions that we want to collect in the patient registration form. Once the patient has completed their form, they can review and submit all of that data. That will all be saved back to Gentu automatically. And if we navigate back to Gentu, we'll be able to see a completed patient file in Gentu with all of the demographic fields filled in. I'll go back to the Consentic UI now, and over here you can track the registration requests on the request list page. Here we can see that the request has been completed, so I know that that patient has filled out the form. We can download a copy here if we want to, and we basically have a log of all of those interactions, the forms, what stage they're up to, whether people have filled them out. This has just been a quick demonstration to show you kind of hands-on with that patient registration flow, how you set it up, how the patients would use it. But there's a lot more in Consentic with the consent management workflows as well. So check out the marketplace and their landing page if you'd like to see more of that. And then ConsultMed. So they've launched in our marketplace just in the last couple of months at the moment with outbound referrals, which I'll show you today. And so when setting up ConsultMed for the first time, you'd be prompted for your pairing code from the Gentu marketplace. This is just revisiting how you set up marketplace apps in general. If I go to Gentu, into the marketplace, and into the ConsultMed listing, I can click Add to Gentu, accept the permissions, and I'll get a code, which will last for a couple of minutes. I'll paste that back into ConsultMed and submit, and the connection is established. So in just a minute, we can have this switched on and connected to the app. Once we've set that up, to create a new referral, you will, in ConsultMed, you would find the practitioner you want to send the referral to. So I'm searching within a hospital, and there's a cardiologist, a particular cardiologist that I'm going to send this to. You can then import the patient details from Gentu. You can either search their details, or you can also just paste the patient URL directly from Gentu, which is a bit of a shortcut. You select the appropriate patient match and click import to automatically populate the referral form with the patient details from Gentu into ConsultMed. We'll confirm that the patient details are correct, and then essentially complete the rest of the referral details in ConsultMed. So filling out that referral workflow. And in the next step, we can add any attachments that we want to add to the referral. We review and finalize the referral. And then last step, clicking submit to send the referral out. Coming back over to Gentu, your referrals will automatically be saved in Gentu. So you've got a record of the referral in the clinical file for that patient. ConsultMed will also send through acknowledgements, advice and guidance, reports, and other correspondence. These will come through to the incoming correspondence folder, as well as that patient's record. And that way you can easily know when that referral has been acknowledged by the third party. And then back in ConsultMed, you also have a history of that in the ConsultMed outbox. So we'll move now into what's coming soon and upcoming. We'll start continuing with Marketplace and then back to the rest of Gentu. And so within the marketplace, we're continuing to broaden out those use cases we want to support. One that we're excited to talk about is we are now working with the clinician who offer PREMs and PROMs, or patient-reported experience or outcome measures. They're currently validating their offer with practices and starting to build. If you'd like to get an early view of what this would look like, please get in touch with me, as I would love to talk with some more practices. And then I know we had a question along these lines for another offering, which I was not familiar with, but we do have 2 new partners starting to work on automated AI voice assistants, handling things such as incoming, in some cases, outgoing phone calls. So not the one that was mentioned. I'll check that one out in the Q&A, but there are 2 partners in this space at the moment getting started. So again, keep an eye on these as we progress, and you'll see them as they get announced. And then finally, as I mentioned, ConsultMed are currently working on inbound referrals, making it much easier for other providers to send referrals directly to you. Again, keep an eye out for the newsletter that will hopefully be available in the coming weeks. And that's all with the marketplace. So I'll hand back to Neve to talk about the rest of Gentu and what's coming soon there. Thank you.
Great. Thank you, Chris. Great to see so much happening in the marketplace to assist with that automating of the patient journey. And I'm certainly interested to see what those call assistants like Zeta and Facere can do to reduce the admin burden of incoming calls. And we'll certainly take a look at Sophie, which was the one that was mentioned in the Q&A as well. Now, while connecting up products that you're already using in your practice has been a focus of the marketplace, I guess building on what Bridge was talking about, we will be continuing to improve the admin and clinical workflows as well across the core Gentu experience. The first big item that we're tackling is enabling users to complete and manage PDF forms in Gentu. We know that the ability to complete forms like work cover certificates has been a pain point for some time, and there just isn't an efficient way of doing that in Gentu today. I know many of you are probably struggling through trying to use the letter writer to achieve creating these forms, but happy to share that work is underway to create a PDF form library, which will actually contain ready-to-use forms like you can see here on the screen. And then those forms, when you use them, will populate with or pre-fill with patient information that's stored in Gentu. And then you'll either be able to print out or email that form to a recipient. So this is a big one, and it has been a long time in the making. So it's great to be getting underway with solving for PDF forms. In the appointment book space, Bea mentioned some of the enhancements that we've been making in the appointment book, and further enhancements will continue here. The first thing is day notes. So day notes is a much loved Genie feature. And what it will allow us to do is that in Gentu, it'll be a versatile field, which you can just see here underneath the calendar on the left-hand side of the appointment book, that will allow users to capture free text notes, basically, about any given day in the diary, and that will be accessible to all staff. So I think at the moment people are popping them at the beginning of the appointment calendar. We're also going to be introducing the ability to jump ahead a number of weeks in the diary when you're booking follow-up appointments. And then for multi-practitioners, we're aiming to introduce an appointment book scroll. So if you have more than 4 or 5 appointment book columns in the diary at the moment, it can be hard to see all of the information. So we'll make sure that those columns are becoming a fixed width, and that you can scroll across if you have more than can fit on the screen. A question that was asked in the Q&A was about the next appointment feature capability. Bridget and the team have taken a good look at that, and it is quite complex, or it is going to take a bit of effort to achieve, but that certainly is on Bridget's backlog as well, kind of beyond these specific appointment book enhancements. So not sure when we'll get to it, but we certainly are aware of people's feedback that they want to have a next appointment type capability. Then next in the admin space is the introduction of an eligibility assistant. So this will allow us the ability to check a patient's health fund eligibility for an upcoming hospital admission or procedure. So the eligibility assistant will check the patient's eligibility based on the item numbers that are going to be added to a quote as part of the quoting process. And so we're really hoping that this will reduce the time that practices are having to spend on the phone with private health funds to understand if a patient is eligible, and will help you to know, about patients' waiting periods or any exclusions, out-of-pocket costs, and so on as part of that kind of procedure booking experience. So work on this is underway. We will have to do some testing with Medicare as part of delivering this feature. So it may take us a couple of months before it's available in Gentu, but really excited to get this online eligibility checking assistant available to you guys very soon. And then from an admin perspective, the last thing that we're working on at the moment is better login capability for people who work across multiple Gentu practices. So currently, if you work across multiple Gentu practices, you need to have a different email address to log into each practice. And when you're in one Gentu practice, you have to log out of that practice to log into another. You can't just toggle between the two. So we're going to be changing how you log into Gentu so that you can log into Gentu with also all Gentu practices that you need to access from one email. And then once you're in a Gentu practice, you'll be able to click on the settings box or your name logo in the top right-hand corner of Gentu and toggle between any number of practices that you might be a member of. We're also going to be introducing the ability for single sign-on. So if you work in an organization which has maybe Microsoft 365 or something like that, and you use that to log into all applications in your practice, moving forward, you will be able to use those authentication mechanisms or login mechanisms to log into Gentu as well. Within the clinical area, we're continuing to work through, sorry, I right-clicked instead of left-clicked there. Oh, I'll just go back one. My husband often says, just click once. I'm a terror for this, even with Netflix. But yes, so within clinical, we're continuing to work through testing with ERX for e-prescribing 3.0 conformance. So hoping that e-prescribing 3.0 will be available for everyone shortly. We're just at the beginning. We're through the initial stage of testing with the Australian Digital Health Agency, and now we're on to the stage of testing with Fred IT or ERX directly. So we do anticipate that will take a number of weeks, but we're certainly making progress there. Probably an important call out here is that when e-prescribing 3.0 is released in Gentu, it will require that all e-prescribing users have multi-factor authentication enabled. So if you are an e-prescribing user and you don't currently have MFA enabled, please consider setting this up ahead of time, because once it is released, which will give people plenty of notice before it goes out, but you will have to have MFA enabled once e-prescribing 3.0 is released, and that's just part of the conformance profile that has been set by the government, a requirement there. Bridget mentioned earlier, we will be working on improvements to the clinical experience within Gentu over the next 6 months. Initially, what we're focused on is clinical filtering, and this is really targeted towards multi-practitioner practices, so enabling you to filter the clinical records, so think the contacts list, consults, letters, diagnostic reports by practitioner. So if you are a multi-practitioner practice, you can just look at those contacts that are relevant to you. But then the other thing we'll be working on is enabling the clinical window configuration. So we appreciate that practitioners within and across different specialties need to work in different ways. And within the clinical tab, we know that not every practitioner needs the patient notes, latest measures, adverse reactions, and so on, boxes that appear down the right-hand side. And so for some practitioners, these are displaying in the right order or in the wrong order, sorry. And for some people, they're just not relevant at all. So what we want to do is enable users to configure the experience that best suits your needs by removing or placing these widgets in the right location. There will be more enhancements to the clinical experience over time, but those are the first two areas that we're going to be starting with. As I mentioned at the beginning, in Gentu, we've had a feature called e-requests for some time now, which allow you to send pathology and radiology requests to labs and receive real-time updates back from labs on the progress of that request. Users have been able to send radiology requests to Sonic Radiology Labs since about February this year, but happy to share that over the coming quarter, these will be extending radiology requests to Loomis Imaging and also South Coast Radiology. We are also speaking with IMED, but in the very early stages, because that's a common question that we get asked in the webinar, is will IMED be coming available for radiology requests? So discussions are certainly underway, but we'll be quite some months, I think, from getting them live, but we'll continue to update you on that as part of our webinar series. And then for those who do order radiology requests, whether paper or digital, we have been working behind the scenes with Promedicus, who's the major delivery partner for results from radiology labs. So this integration is completed from a development perspective, and we're now in the final stages of testing, and we'll be launching across a range of labs really between here and Christmas. So we're going to start with North Shore Radiology around September time, and then this release actually requires the radiology lab to do an update on their side, and so it'll be made available across partners like IMED, Radiology SA, and Dr. Jones and Partners over a number of months, I think, between here and Christmas and potentially even into the new calendar year. As mentioned earlier, we are working towards that third objective of using data-driven insights to help you make better decisions. And so another thing that the team has been working on is using large language models to structure data that exists in consult notes and letters to understand what insights exist in there so that we can present it back to users in the form of dashboards. So the initial focus area has been on cardiology, and we have 3 new cardiology dashboards which are currently in pilot. So the first one is an ASCVD dashboard, which helps users to track and manage patients with, I'm going to butcher this, but atherosclerotic cardiovascular disease. There's another one which we're calling a valve patient dashboard, which gives users the ability to view patients with valve disorders so that you can prioritize follow-up or intervention planning. And then finally, there is a dashboard called HCM, which supports the monitoring of patients with hypertrophic cardiomyopathy. So these dashboards are in pilot. We have a number of Genie practices on board currently using them, but we're really interested in having some Gentu practices come on board and pilot them before they're available as a general release. So if you're a cardiology practice and would be interested in having your data that exists already within Gentu processed and represented back to you in these dashboards, please do reach out and get involved. And then last but not least from me, I did just want to call out 3 areas that we are receiving a lot of feedback about with respect to Gentu. So it's really clear that Gentu has some gaps in capability at the moment for managing things like tasks and recalls. We're also hearing that users are wanting better financial integrations, with lots of requests coming for integrations with things like Tyro, Xero, MyOb, and also better financial reporting capability, both breadth and depth of reporting capability. So over the coming 12 months, we will be looking at these areas specifically. So not, in these webinars, we try to talk about what's coming, definitively for the next 3 or 6 months. But what we'll be doing is we'll be starting to look at these problem spaces and also looking at how we can leverage AI to automate some repetitive tasks or reduce admin tasks for you. So we'll aim to provide more specific details on what we can do to tackle these problems in the next webinar that we have around November time. Now I'm going to hand over to Tam, who will then provide us with our final update, which is on the mobile app.
Okay, just requesting control.
Great.
Okay, all right, great. Thank you so much, Neve, and so many exciting things in the Gentu space. My name's Tam. I'm a principal designer here at Magentus, and I work on the mobile app, and I'm here just to talk you through some recent released features that we've had, that we've recently done, and also a sneak preview at what's coming next. But before I get into that, I just wanted to quickly touch on our mission in the mobile app. We know that doctors work at different locations and they're often away from their clinics. And that's why we're focused on the mobile app at Magentus, because we want to bring the power of Gentu to your pocket so that you can continue to care for your patients, even when you're away from your desktop and your laptop in your clinic. So you can continue to provide care. And in line with that, we have released a major update for obstetricians for when they use the mobile app. Previously on the mobile, obstetricians had no way of seeing the pregnancy record or pregnancy information, but with this update, obstetricians now can see a snapshot of the pregnancy record in the patient file, obstetric and medical history, the last antenatal visit. We've also streamlined the way that you input birth information, and you can now access the birth form from the mobile. And if you're a voice user, you can also use voice with this new feature. And I just wanted to show you this workflow. So I'll just start. So you would navigate to the patient from the appointment book. Straight away in the patient file, you'll see the current pregnancy. Clicking on more details, it'll take you to the antenatal tab. From here, you can see straight away that you've got the obstetric history and the medical history. Scrolling down, you'll see the additional notes field enabled with voice. And then at the bottom, there is the last visit. Clicking on the birth tab, you'll see now that you have access to the birth form, which means that when you get called out for a delivery late at night, you no longer have to wait till you get back. You can just capture all the information right then and there into Gentu. You can capture all the details about the delivery, as well as information about the children. And when you save that, that goes straight into Gentu. So that's an overview of the updates that we've done to help obstetricians continue to perform while on the go. So next up, I want to talk about the updates that we've just done to uploading documents and also capturing images via the mobile app. We've actually received a lot of feedback about this area, and we have listened. Now, from the mobile app, you can scan documents directly into the patient file. And when you take photos, you can take multiple at a time. And also in the unlikely but important time when an upload fails, you can now handle that through the app. I just have 2 videos to share with you today just to show you how that works. So I'll just click, oops, wrong video. So you can scan documents straight into the patient file from the appointment book. You just need to click on the ellipsis file. I select scan document from the patient options. That will take you into the scanning workflow. Here it automatically frames and captures each page. And then clicking on that stack of papers in the left-hand bottom side will take you into the editing workflow. Here you can crop, rotate, and change the color of the scan. I want to get rid of that shadow, so I'm just going to click on black and white, and I just need to do that to each page. When I'm done, I go back into the scanning workflow. Then clicking on save will take me to the preview. From this preview section, I can change the name, the date, and the category, and then upload will put that straight into Gentu. So that's gone straight in. And the next video that I'll show is just taking photos. My patient isn't in the file, so I'll go in the appointment book, so I'll go through patient search. Whoops, sorry. Sorry about that. I'll go through patient search. When I'm in the patient file, I can click on the plus button. That will bring up the options again. I'll click take photo. From here, I can take multiple photos at once. So here I'm just taking 3 photos. Clicking done takes me to the carousel. And from this carousel, I can actually rename all the photos, any of the photos that I want to. I want to rename 2 of them. And I can also change the date and category of any of those photos by selecting them from the carousel. I'm happy with the date and category, so I'm just going to hit upload and that will go into the file. And so that's the updates that we've done to documents and photos. They're highly requested feedback, so we're excited to get that into your hands. Next up is what's coming soon. We know that one of the key reasons why doctors and other users use the mobile app is that they want to be able to prepare for their day. They want to manage their time and they want to track their work that they're doing on the go. And that's why we're planning a major uplift of the appointment book. From now, you'll be, when this is released, you'll be able to see your events in your appointment book. You'll be able to see your appointment notes. The day notes feature that was just recently, that was talked about as a coming soon by Neve, that will be available in the mobile app. You'll also see the calendar view, just like in Gentu. You'll be able to book appointments on the go, and you'll also be able to see a patient's next appointment in their file. And I just want to show you our proposed booking workflow. So straight away, you'll see that this is the calendar view, and you can see your schedule and your events. Clicking on the plus button, you'll be able to add an appointment via that menu. But because it's calendar view, you'll also be able to click on the gaps. Just like in Gentu, you'll be able to search for a patient and select them. Their details will come through. You're able to update the phone number, add notes. Because I did click on the gap, the location and appointment type will be pre-filled, just like in Gentu. I can update the appointment status via this workflow. And also, oops, sorry about that. You'll see that the date and time and duration has come through, and then that will go straight into your appointment book. We're really excited about these updates, and we can't wait to get them to you. And then lastly, I just want to touch on our craft group. It's something that's central to how we work at Magentus. Co-design is at the heart of how we do product, and the features that I've discussed and many others, as Bridget and Neve talked about, are done in partnership with our users. The craft group is the way we connect our product teams with our users. And as we work through the roadmap, we reach out to users who are part of this group to seek feedback, and we cater to their interests and their time. The craft group empowers users to share their needs, their insights, and a typical session will be us listening to your problems, showing you things that we think might be a problem, as well as sharing early design concepts. So if you're interested in this, please sign up either via this QR code or the survey at the end. And then lastly, just one more slide. We actually have a collaborative craft group event coming to Melbourne on the 20th of October. It's because we've got the AAPM conference, which is for practice managers. So this event will actually be for practice managers. These events are really fun. They bring our customers and our product teams together to work on problems together. So if this is something that you're interested in and you're in Melbourne, please make sure you register via the survey at the end. And now I'll just hand back to Neve.